Hi, I'm Glenn McGinnis, host of Outburst on the Cable Public Affairs channel. Lately, we, like many others, have been doing things differently. We've been talking to Canadians across the country via Zoom about the COVID-19 pandemic and the issues surrounding it. We posed this question to Canadians. Are you satisfied with the federal government's response to the COVID-19 pandemic?
This was after SARS, and that they would have a plan in place and there would be stockpiling PPE, but clearly that hasn't been happening. I know there's a major shortage right now in Nova Scotia, Ontario, and across the country, but economically, I've been impressed with their response. I think this CERB has been successful, but I would like to see more support for both seniors and students. And I know we've been waiting on an announcement for quite some time for students, but they really need to, I think, accelerate in that area.
I think hearing the PM's responses every day has definitely helped ease some stress and help a little bit of, give a little bit more reassurance as to where the COVID-19 pandemic is going. I also find that they're doing a lot to educate and prevent the spread of it, and I find that that is very helpful. Staying educated, I believe, is one of the most important things that Canadians can do, and knowing that they're doing those extra steps to keep Canadians educated is very reassuring.
I'm not 100% satisfied with the way they responded, but for the most part, yeah, I'm kind of satisfied with the way the federal government is laying out the necessities that they need for what's going on right now. Kind of seeing something as far as the nonpartisan politics where they're kind of working together a little bit in some capacity, which I believe alleviates the fears of Canadians that know that the government has got a little bit of a grip on this. I would have liked to see them take a little bit more stringent actions as far as shutting down borders and at the time, but overall, for the most part, I think the federal government's doing okay.
It is really upsetting to have that issue where I come from, and then having that major threat that you have not those resources accessible to northern communities, including First Nations. And also with the past recent news, probably last month ago, about that $305 million support from the federal emergency plan for First Nations is, in my opinion, is not enough. Because with the 305 million divided by 634, that's only close to up to $500,000 per community, and that doesn't cover the resources for high demands of health resources to defend the COVID-19 pandemic and all the other needs that northern communities and communities that have the less resources and needs to defend off their own people.
The area that I'm most concerned about is health inequality, and we really need to understand which communities are being impacted more severely. And so one thing I haven't seen done yet, and this falls more into a provincial jurisdiction, but I think the federal government has the capacity to strongly recommend it for provinces, is to mandate that hospitals and research labs collect information on which communities are being more strongly impacted by the virus right now. I think it's going to be able to help us focus and narrow our research and cater our healthcare better to serve Canadians that are more at risk.
I mean, they probably haven't been faced with anything like this before, so it's really nothing to gauge it against. I'm all for the stimulus packages that they're going to give to people and so forth, but it has to go to the people who need it and not big business and big political party supporters. That's what's happened in the past, and it's that can't be the way of the future. This is a lot of money that they're talking about, and a lot of money for Canadians to pay back over the next number of years. So I'm happy that they're addressing it, but I want to see crystal clear transparency from our federal government about where the money's going, and I think every Canadian deserves that.